Welcome back. May is Mental Health Awareness Month, and the American Foundation for Suicide Prevention encourages people to have open conversations about mental health and to directly inquire about suicide if someone's struggles persist. Here now to tell us more is a VP of Health Equity at the American Foundation for Suicide Prevention, Vic Armstrong. Vic, thank you so much for joining me.
Thank you for having me.
Now, can you tell us about the Talk Away the Dark campaign and its focus during Mental Health Awareness Month this May?
Absolutely. Well, the American Foundation for Suicide Prevention, our mission is to save lives and bring hope to those who are struggling with suicidal, with the effect of suicide. And so, our Talk Away the Dark campaign really is an initiative that's designed to give us an illustration of how you can have a conversation with someone who you suspect may be struggling with suicidal thoughts, but they're not openly talking about it. So it's a really good indication of how you may recognize the warning signs, but when that person doesn't open up, you can initiate the conversation and then connect them with resources. Having a caring conversation with them and connect them with resources. You can find our Talk With the Dark campaign at afsp.org/talkwiththedark. In that same space, we also have our Real Convo Guide. Our Real Convo Guide is gives you a step-by-step guide on how you have that conversation and connect it with resources. And our new Real Convo Guide even gives you step-by-step guidelines on how to have conversation if someone is hesitant to reach out for help. So if you have the conversation and they say, I don't want to go into therapy because therapy didn't work for me before. Or I don't want to take medication. Or I'm afraid of being hospitalized. There's information there also on how to have those kinds of conversations because the most important thing to make sure that we're getting people connected to the help and to the resources that they need.
Now, the CDC reports a rise in suicide rates in recent years. What are some of the contributing factors to this increase?
Well, there are a lot of different reasons that people end up at a state of suicidal desperation. And one of the things that I often share with people is that suicide itself is not a disease. It is actually the worst possible outcome of a combination of a lot of very complex things, which often includes mental health challenges. We do know that there was a huge impact on our mental well-being collectively as a result of the COVID pandemic. We saw the fear and isolation that accompanied the COVID pandemic. But we don't have all of the answers as to why suicide rates are going up. We did see about a 3% increase from 2021 to 2022 to about 50,000 deaths by suicide. And of course, even one death is way too many. But what is encouraging about all of this is that even though we've seen this increase in suicides over the past year, or between 21 and 2020, 2022, we also understand better today than we did even 5 years ago, 10 years ago, about how to address suicidal desperation, including not just giving people resources, but also in resources to deal with folks that are at suicidal crisis, but also giving folks resources to help us to reach people before they get to that point of suicidal crisis. And our Talk Away the Dark campaign, to me, is one of those resources because oftentimes we can intervene before a person really gets to that point of wanting to end their life. We can save that person's life.
Now, you mentioned something that I thought was very important, and it's that the way we talk about this has evolved even in 5 years. When it comes to having open conversations about mental health, can you talk about the way you've seen these issues or these challenges change from, as you mentioned, 5, 10, even 20 years ago compared to
Yeah.
now?
So the one thing that we understand better today is that not all communities have conversations the same way. Not all communities access resources the same way. And so we have more research today that's really teaching us how to access communities and how to access people in the communities where they live, work, play, and worship. And so that's one of the things that has changed. What it really has not changed is that the basic tenets to increasing awareness and reducing suicides are still that we want to normalize a conversation. We want to have open dialogue. We want to ask someone clearly, concisely, confidently if we think they're thinking about killing themselves. We want to talk to them privately. You don't want to do it out in the open. You want to listen to their story. You really should listen more than you talk because you're not trying to fix the situation or fix the person. but you're giving them space to talk about what's going on with them. What we know differently now is that conversation can look different in different communities. So we've created resources that allow us to speak to uh, communities that may not have been as accustomed to having these conversations. One of the things that we spell out, even in our Real Combo Guide, is that while we give you guidelines on how to have these conversations, we also want to be mindful that there are cultural differences and that the conversation it may arise differently in different communities. I come from a community growing up in rural North Carolina, son of a preacher, raised as as a black male. I come from a culture where we were taught that we don't talk about suicide, and that suicide is not even something that impacts the black community. But we know differently now that it does impact the black community. So now we're able to reach into communities that we have not had these conversations with, decades ago, and now we are having these conversations. We are raising awareness. And I think that's one of the biggest changes that we see now.
And I'm really glad to hear you say that because I think that previously there wasn't a lot of cultural competence when it comes to mental health and how different communities respond to mental health, which in turn could make a lot of people turn away from seeking help because they feel that maybe the social worker doesn't know what I'm going through, and so I'm so glad to hear and see that we're making progress in that regard. You know, on the same token, I want to know, is there have you found ways to talk to different age groups in regard to this? So, how is your organization working with teens or even children who are struggling
Mhm.
with mental health?
Yeah, I think the one thing to keep in mind, though, is that the constant with suicide is that a person experiencing suicidal thoughts, they've lost hope. They lost social connection. So what we're trying to accomplish is not different, but the way that we do it is different. So for a younger population, we know, for example, that a teenager is 76% more likely to talk to a peer if they're experiencing crisis than they are to talk to a mental health professional. So the more that we're able to teach young people to have the conversations themselves and to be able to support each other and connect each other with resources, the better we're able to reach those communities. And that can be done through things like mental health first aid for youth, but it also can be done in some of our campaigns and things that we're doing to raise awareness and thinking about where people get their information. So for young people, we are using a whole lot more social media to raise awareness because we know that that's where a lot of young people are spending their time. We're looking to find trusted messengers who resonate with young people. We had a campaign recently with Megan the Stallion, and that's because we're trying to reach that younger audience. So we are thinking about ways that the message is the same, but the way that we package the message may look different for different communities, different age groups. We even have differences in how we may want to reach rural communities versus urban communities because the access is going to be different.
I love to hear that you had a campaign with a major pop star or rapper, which I think helps kind of put an end to the stigma or reduce the stigma around mental health. What are some ways communities and individuals can work together to create a supportive environment for those struggling with mental health challenges? And what are some things that we can all do to help reduce that stigma?
One of the things that I encourage people to do all the time is go to our website. If you go to afsp.org, you will find resources on our website that can connect you with resources in your community. If you want to connect to a local walk, if you want resources that help you to support someone else who may be struggling, if you're a suicide loss survivor, you're looking for resources to help you to heal, you find those resources on our website, and you can connect with other people who may be going through the same thing. So I encourage people to visit our website. We also have local chapters. We have chapters in all 50 states, plus Washington, D.C. and Puerto Rico. So I encourage people to reach out to our local chapters to find resources, to find out how you can get involved. So there are things that we all can do to help prevent suicide and to raise awareness.
And I want to thank you so much for joining us and having this conversation. I think that this is the first step to helping our community understand that, talking about mental health is normal. It's something that we should all do. And this is just one step towards, as I mentioned, reducing that stigma. And I'm really glad to hear about the work your organization is doing. So thank you so much for joining us and having this discussion.
Thank you. Thank you for having me.
For more information, you can visit the website at talkawaythedark.afsp.org and call or text 988. Don't go anywhere. We'll be back with more Open right after this.